My bad.
That's okay. I was like,
So I was, so I'm
what I looked
somehow.
like 15 minutes ago and what I look like right now is two totally different looks. I'll be having braids around the house.
So I was like, man, I'm always late or something. I was like, I'm gonna be on time today. But
Nah, you
I
good.
put 7 o'clock on the thing. I didn't even look at it. I just be like doing a million things. I ain't pay
Oh,
attention.
okay. I did see that you reposted it, but I didn't read it. I just,
Yeah, I just put 7 o'clock. I'm sure, man. What's
okay.
up?
Hello. I was like, oh, you got my hair on. Okay.
You
On
good? You good to go?
now. Hello of Guadalupe.
Really? Really? Nah, they kidding. They ain't in Guadalupe. It might be.
What
That's
time
possible.
zone are they in?
I have no idea. Uh, uh, all right, you got all the questions. So, all right, so this is the official thing. So we'll be talking about a lot of different things, but the conversation will go as it may. Whatever people want to ask, want to talk about. Cola has her, questions already. So for everybody that's new, I'm Doc P. This is Cola. This is Cola Red. She is a patient of mine, and had a very, long, very interesting ordeal with fibroids and surgery. And we documented it all. And through that, there was, just a Pandora's box of just information and interest that came from her story. So we decided to continue it. So this is what we do. We, answer questions and let you guys hear, just women's health from the doctor's perspective and the patient's perspective. And I think it's a very unique platform that we've created. So share it with folks because I think it's very helpful for people that watch. But I talk enough, so let me shut up. Go ahead, Cole.
No, you all good. So if you have questions tonight, I have some that people have submitted already. I have some that are, you can drop a question in the bottom of the screen. There's a question mark inside like a comment bubble. If you
Man,
click on that, you can
she
actually,
getting into it. She said, "How was your sex life with fibroids?" She got
oh, well, I answer that.
we actually did we me and her did a very interesting live as well too. That was pretty dope. But yeah, go ahead and answer that.
Yeah.
That's I'm gonna let you have at that.
But before I
Yeah.
answer the question, I just want to make sure so people know how they can ask questions. So people can send them in. I mean, people have submitted them to me already. You can drop a comment in the comment box at the bottom of the screen, and then you can also request to join the live. So if you request to join the live, if you want to ask your own question, you almost get a free consultation on the spot. So that's why we call it free game Thursdays, I guess. I would say Friday, but it's Thursday. So yeah, so those are the different ways that you can answer. So I guess somebody put in the comments because it's little on my screen. How was my sex life with fibroids? So with fibroids, initially I didn't have any problems. As it got towards where I was at the 32-week pregnancy size fibroids, I would have very, very, very bad cramping after sex. So during sex was okay, but after sex I would cramp really, really, really bad to where it was unenjoyable for my spouse to see me that uncomfortable after sex.
And have you seen exactly what she had up in there? It couldn't be comfortable for nobody. For him, for you, it was just
Yeah,
bad all around.
it was pretty bad. People still DM me and be like, "That was inside." Like,
It
yep, that
was.
was the real deal.
It was. All 6 pounds of
All right. So I'm gonna start with some submitted stuff. Oh, no problem. I'm gonna start with some submitted stuff, and then I'll go back and forth from the comment Bible. And like I said, if you want to join, you get a free consultation. So feel free to join in the live as well. All right.
Show a picture. So her picture. So if you scroll back, her whole journey is on my page. So like from her very first visit, we talked about like how she was feeling. Did an exam and showed you where her fibroids were at to actual surgery, to where I showed what the masses look like on the inside of her. So if you all have curiosity about it, just scroll back. It's there. Just gotta look.
Yeah. And I actually put the pictures of what came out of me on my page as well. So I may not have as many of the visits, but I do have the actual pictures on my page.
Yeah. But
All
yeah,
right.
her pre-op, actual surgery, and post-op visits were done, and they're on my page. So let's take a look at them.
All right. So first question of the night. Can you explain what is a bulky uterus?
What a bulky uterus is? Well,
Mm-hmm.
um, that's a difficult question. A uterus size is dependent on multiple things. It's dependent on age. It's dependent on how many children you've had. So like a multip uterus is usually a little bit bigger and kind of stretched out. Not I wouldn't say stretched out. For they run with that, but it's usually a little bit bigger. I would expect a woman that's had 3, 4, 5 children to have a slightly larger uterus than someone that has 0 or 1 kid. So that can contribute to bulky, but pathologic bulkiness to the uterus typically means that there are cells within the uterus that are growing that shouldn't be there. So one particular condition that contributes to a bulky uterus is adenomyosis. Adenomyosis is when the lining of the uterus actually grows into the muscle of the uterus. And when that happens, it can cause like just the abnormal growth of the uterus. So those uteri are like, can be 14, 16 week gestational size, or like a 3, 4 month, 5 month pregnancy, and they don't have any fibroids or anything like that. They just have uh, um, a lot of inflammation and cells that are growing within the muscle that are making it bulky. So that's um, really, I guess a kind of a breakdown of bulky. But no matter what, if you're not having abnormal periods, you're not having, pain, pelvic pain or pain with extensive pain with your cycles, a slightly enlarged uterus is negligible. It doesn't mean much of anything. It only becomes a conversation or an issue when there are things that are pathologic, like adenomyosis, like endometriosis, like fibroids, that are causing it to be bulky, that are causing you to have pain, causing you to have cramping, causing you to have discomfort, causing you to have dyspareunia or pain with sex. Like that's really when it becomes a discussion. Other than that, a uterus is a uterus.
All right. So since you brought up, I say adenomyosis. Is that how you say it?
Adenomyosis. Mm-hmm.
Yeah. Since you brought it up, someone said, is the only treatment for that a hysterectomy?
The only definitive treatment for it is hysterectomy. That is true. Um, it's not the only treatment, because when you talk about treatments, anything when it comes to treatment, anything that helps alleviate symptoms is a treatment, right? So when I give women options for fibroid treatments or fibroid therapy, um, some of those options they're not going to get rid of the fibroids. They may work on the symptoms. So they're treatments similar to adenomyosis, where adenomyosis, again, is the lining of the uterus growing into the muscle of the uterus. that causes pain, that causes abnormal bleeding. It can cause discomfort. So with that being said, medications that can alleviate some of those symptoms are treatment options. However, they do not eradicate or get rid of adenomyosis. Adenomyosis is going to still be there. So with that being said, the only definitive therapy or definitive treatment for adenomyosis is hysterectomy. But there are multiple different treatment options for it. But definitive therapy for it um, is to have a hysterectomy. Um, yeah, hope that answers that.
All right. Question in the chat bubble. How can physical therapy benefit post-op fibroid patients?
Physical therapy. Say it again. Physical therapy benefit post-op fibroid patient?
Yeah.
Not much. I mean, the only thing that I would say to that, I don't know if you mean pelvic floor physical therapy. So if you have a pelvic floor dysfunction, that's the only real thing that I could see someone talking about. Where pelvic floor, when people have weakening of the pelvic floor, you can have urinary incontinence, you got prolapse of different organs into the vagina. So pelvic floor physical therapy works on that part. But 9 times out of 10, when someone has a fibroid surgery or pain from fibroids or issues with fibroids, once you remove the fibroids, you don't necessarily need physical therapy after it. So it doesn't really impact that. Somebody asked another question that was good on here that I saw. So it asked, yeah. So make sure you ask me about, do fibroids grow back after laparoscopic myomectomy? I want to address that.
Okay.
So yeah, somebody asked that. That's a good question. But I hope that answered the physical therapy thing. Pelvic floor physical therapy, again, is what I think you're referring to, but it's really not related to fibroid therapy. You don't have to have any type of physical therapy after fibroid surgery. It's not going to be very helpful. Now, if you have issues that are unrelated to fibroids, like incontinence, like prolapse and things of that nature, then yes, physical therapy or pelvic floor physical therapy is helpful. But separate the two. Those are two different things.
Okay. So you said the question was, my screen is so little I can't see it when it come on there.
I got it. Yes. So do fibroids grow back after a laparoscopic myomectomy? All right. I want you guys to really listen to this, because I talk about this extensively, and I don't hear a lot of gynecologists talk about this. Like, I'm honestly, I think I'm a little unique in my thinking with this, and it really comes from years of performing fibroid surgeries and being, just exposed to, fibroids, different treatment options, and listening to patients and watching things. And this is my take on the approach to surgical management of fibroids. So first and foremost, I am a laparoscopic surgeon. I am a minimally invasive specialist, meaning that I pride myself on making small incisions, using tools through those small incisions, and performing surgeries. With that being said, I am no longer a proponent, meaning I don't necessarily agree with laparoscopic myomectomies anymore. I don't routinely perform laparoscopic myomectomies anymore. I used to. So I've been an independent practitioner for 9 years now, going on 10 years. And in that time, when I first finished residency, I was all about gun ho laparoscopic myomectomies, minimally invasive, get patients out, perfect, minimally invasive stuff, minimally invasive, minimally invasive. That's all I was about, right? But over time, I started to notice something. I started to look at my recurrence of fibroids, like who was coming back, who was still talking about, I still have fibroids at the end of the day. And it really wasn't my open patients, the patients that I opened to give fibroids, to do fibroid surgery. The recurrences that I had were laparoscopic myomectomies. Why is that? The reason why is because, and this is my opinion from my experience, is that When you deal with fibroids and you deal with fibroid surgery, it is important to get all of the fibroids, right? It is important to get every speck of fibroid tissue that you can find, right? And I see this all the time. So for every woman out there that's looking for a surgeon or what have you, unfortunately, I see the worst of the worst. And I see so many times where surgeons will go in even with open surgery and they'll leave fibroids back because they don't, they're nervous about the blood, or it being to structures that may cause a lot of bleeding, whatever. That's a problem. Like, I've never performed a fibroid surgery where I'm not taking every single part of a fibroid out. That's what is important when you look at the recurrence rate of fibroids. So with that being said, in regards to the laparoscopic myomectomy, when I do laparoscopic surgery, the only thing I can do is get what I can see, because with laparoscopic surgery, it's small instruments going into the belly and I'm doing the work with the instruments, whether it's robotic or laparoscopic, same deal. It's what I can see. Fibroids can literally, if you've seen fibroids on my page when I take pictures, even with colas, like you have fibroids that are literally the size of half of a pea. And if you have that and you cannot feel it, you're going to leave it, right? Any fibroid that's not this big is going to get left because I can only see it, right? And so with laparoscopic surgery, if you leave those, my experience is that they can get bigger or come back in the future, as opposed to an open myomectomy where you're able to feel the uterus completely and get every speck of fibroid. That's what I'm a proponent of. That's one reason why I'm a proponent of open myomectomy. The other reason I'm a proponent of it is because when you have fibroid surgery, so 99% of women that are getting fibroid surgeries have expectations of getting pregnant in the future. That's why you're preserving your uterus. So if you're doing that, when you have extensive fibroid surgery, you're really obligated to have a C-section in the future. So with that being said, it doesn't make a lot of sense to do a laparoscopic surgery for fibroids or myomectomy when you're going to have to go back to perform a C-section after it. It just doesn't make a lot of sense. It makes more sense to make the smallest incision possible to open to get all of the fibroids out, and then utilize that same incision for the C-section in the future. And then people will ask, well, Cola had a laparoscopic or robotic surgery. Why can't you do that? Why can't everybody get that? Great question. Cola didn't have a myomectomy. Cola had a hysterectomy, which is different. Those small, even though her fibroids, her masses were 10 times bigger than most of the fibroids that I deal with, everything was coming out. So I didn't have to worry about getting all of these fibroids out of her uterus because all of that stuff was coming out. But if she was preserving her uterus, 1,000%, she would not have had a laparoscopic surgery. She would have had an open surgery to preserve her uterus. So I hope that clears it up. People really don't understand it. People want to argue like, well, my doctor said I can get a laparoscopic surgery. And that's fine. Your doctor can say whatever you want. Like, that's cool. This is what I do. I do this all the time. This is my niche. This is what I'm good at. So with that being said, I'm telling you guys this from my experience of what I've seen and how it comes back. And when you think about the reasoning, laparoscopic surgery is always the best thing. Don't let me tell you that open surgery is just better. But in this particular surgery, open surgery is better for the reasons that I'm stating. I always want to, minimize the incision, get patients out of the hospital, get them to recovery, do all of those things. But when you're talking about preserving your fertility and your future fertility and doing what's best, getting all of the fibroids is the most important thing. And with that being said, you cannot do it unless you can feel the uterus. No matter what they tell you on ultrasound, they said, I got 3, they got 4, they got 5. Never listen to ultrasound. I can't recall a fibroid surgery that I have done in which the fibroids that I counted during surgery are the same amount that they counted on ultrasound. It's always different, always different. So understand that. And the only way you can get that is if you feel them. You have to be able to palpate to get everything out. All right, I'll shut up now.
No, that was excellent.
But they ask this all the time. And I really, really, really want people to listen to my explanation with this, because I get this question all the time and I want them to hear me do it. But it's like, I'll say this and then people won't listen or what have you. I want them to really understand what I'm saying because it's extremely important.
No, I like the way you explain stuff. It's like a teacher. I see the numbers changing a lot. So if you're just joining and you want to submit a question for tonight's live, use the question box, the question bubble at the bottom with a question mark in it to submit it in there. That way, when we have to end, if we didn't get to your question, I can screenshot it and roll it over for the next live. If you want to request to join the live, you could get a free consultation on the spot. So feel free to send DocP a request to join in person, and you can ask your question yourself. All right.
Hey, Stacy, I'll see you. I'll see you in a week. That's one of my classmates from college.
Oh, okay. All right. Does your diet slow the growth, or do they steadily grow every year or so? I can answer that.
Go ahead. Please tell them, because they don't want to believe me. They don't want to
Right,
believe me.
so
But go ahead.
before I had fibroid surgery, I lost a significant amount of weight, over 65 pounds, changing my eating habits drastically. Like I said, 65 pounds. My fibroids did not change size. They actually grew. So you can lose weight successfully with fibroids. If anybody say you can't lose weight with fibroids, that's not true. Actually, I've learned since doing the live that the reason my periods, the heavy days were less from losing weight is because I wasn't holding as much estrogen in the fat cells, because I decreased the amount of fat I was carrying, but I still had heavy bleeding 3 days every time I came on my cycle. So it went from 7 days of heavy bleeding to 3. So my anemia might have got better, but the fibroids do not shrink if you lose weight. But you can lose weight while you with fibroids. So I don't know if they were thinking that, but you can definitely lose weight with fibroids.
It's the same. It's the same concept. What, like, people feel that liposuction is going to just make you skinny. Okay, it's not. Or liposuction is going to make you lose all of this weight. It's not. Like, when you go through liposuction, literally you're talking about 2 to 3 pounds of weight loss, because that's really what's in your belly of fat. Like, you carry fat and stuff all other types of places. So with that same concept, people that are obese or overweight, it's not all because of the fibroids. So you can lose weight outside of the fibroids, right? They're two separate different things. So don't think that, don't try to blame all your weight or all your issues on fibroids. Fibroids do a lot of things. They're not going to put you 100 pounds overweight. So just because you're struggling with fibroids doesn't mean that you should not, focus on your overall health and your overall weight or what have you. And please don't believe, and I keep saying this to folks too, like, we live in a capitalistic society, right? Everything is about making money and capitalism, right? So that doesn't stop with medicine. So when you have a problem, realize people are trying to take your money. So I can watch how easy this is. Watch how easy this is. See this right here? If you take this and put a drop in your coffee every day, your fibroids will shrink. This is a magic elixir. This is a fibroid shrinker. It's endorsed by Dr. Pierre Johnson, DocP, Doc for the Streets. $39.99. Look at my website and do it. A lot of y'all gonna believe that BS. Like, you're gonna believe it because I'm telling you, and like, oh yeah, he knows fibroids. He's gonna do. But I at least have credentials. Like, y'all believe in people that ain't stepped foot in a medical school, that, like, dudes that have absolutely no idea about women's health at all, like straight dudes with do-rags on, talk about, yeah, I got the fibroid pills right here, good, like, y'all, I swear to God, look, somebody sent me something with this dude with a do-rag on, and he was selling these damn pills. Like, he was like trying to break down all of this stuff, like, about like how his, these herbs and stuff he was selling, like, breaks, like, people buying this shit. Like, I'm telling you, like, y'all really have to think about it. Like, what in this magical elixir is so great that everybody, like modern medicine has not figured it out. Like, even let's take modern medicine out. Just like think about the drug companies that are making billions off us for medications that actually work. Do you think for a minute, if it was something in this old fibroid elixir tablet, that they would just package it up, and Bayer, Pfizer, all of these freaking big drug companies wouldn't take it and start packaging it and selling it to you? Like, think about it. It's just not, you got to think about like capitalism and what people's intentions are when they're selling you stuff, and when you actually believe things, and who you believe and who you listen to. It's the same thing with like, COVID and everything else. Like, man, everybody is going to capitalize off your ignorance. If you don't know, they're going to make money off of it. All right, I'm done. I'm going to shut up.
No, that was good. All right.
Yes, they still grow no matter what your diet is. They're not fed with diet, right? They're not. I operate on vegans, vegetarians, fitness experts. People who just have all plant-based diet. People who who eat all meat. Who are, like, you name it, I've operated on them. Dietitians, like, I have operated on them. So if any of this was true, there would be just a uniformity in my patients, meaning that, damn, here go another girl to just eat meat every day. Look at her fibroids growing. Look at all my vegetarians. None of them have fibroids. I'll be on here preaching to y'all, stop eating meat and making your fibroids grow. I'm operating on everybody. So anybody that gets on there telling you whatever you're eating is doing it, and they have this old magic, diet that they're going to sell you to make your fibroids shrink, are lying. They're lying to you. Stop it. Don't believe them. All right, I'm done. Go ahead.
No, you're right. All right. Another question in the chat. Why do Black women get fibroids at a higher rate than white women? And why are the cases more critical?
So that's a little bit of a misnomer or misinformation. Do Black women or African American women have a higher incidence of fibroids? Yes, it's negligible. So when you look at it overall, fibroids are in 80% of African American women, meaning 8 out of every 10 of Black women, but they also in 7 out of 10 or 70% of the general population. So that includes Caucasian women and stuff too. So why that extra 10% in Black women? It can be, multiple theories about it. We really don't know, but at the end of the day, it's really negligible. I operate on white folks too. Right, Hispanics too. They got fibroids too. Like they having problems with it too. The difference is, I'll tell you what the big difference is really what's going on with healthcare, like in our country, and the fabric of medicine is that other cultures, they go to the doctor regularly, right? So if they, if they get to those things earlier, and get earlier diagnosis, and have multitudes of treatment options where they're not going through 5, 6, 7, 8, 9, 10 years of problems, then they don't complain about it as much. Whereas, our culture, you call it what you want, it is what it is. Don't, some of y'all could bleed for 5 years straight and be like, I ain't going to the doctor. It just ain't happening. I'm not doing it or whatever. So by the time you get to me, it's like fibroids just have taken over. So yeah, and that's the story that you're going to talk about, which is your truth. It's not a lie. But when you look at, is it really impacting our culture worse? I would say that it has a lot to do with our value, not our value system, but our relationship with medicine and doctors. I think it's more so has a lot to do with why it plagues Black women more. Is just because the mistrust of the healthcare system, which is valid, has every validation that known to man. So I'm not saying that it's wrong, but that's the reason why I believe it's worse than what we think it is.
Yeah, I can agree with the mistrust part.
Yeah, boy. Cola came in with a whole little midget. Told me I ain't going to the doctor. I ain't. Me and this midget go die.
I basically was on that. I tried to not come today. I made the appointment.
I know.
I'm telling you, y'all had a fire drill. I was on the phone with my best friend. Like, this a sign, girl. They
Yeah, it's
standing
a sign.
outside. I shouldn't
They
go
trying
in
to
there.
kill me.
And she was like, I'm calling your husband if you don't go in there. You gotta go. And I was like, nah, this is a sign. So I was just fearful, but I'm glad I overcame my fears.
I'm glad you did too. Your body, and your husband, I'm sure, are even more glad.
Yeah, I'm definitely. It feels so much better. I don't
Yeah.
even recognize my new stomach.
Yeah. So there's another question here that said, do fibroids shrink after menopause? Yes. Yes. So that's a yes or no question. I have to be very careful about answering that. So because a lot of women will be played with fibroids and just say, all right, I'm just gonna wait it out to menopause, and and then it'll just get better. That's not the approach, because if your fibroids are excessively large, then the chance of them shrinking to a acceptable level after menopause are lessened. Um, so it's the yes part of it is like, yeah, if you have moderate sized fibroids, they will lose some volume after menopause. But if you have significant problems and issues with fibroids, with size being the biggest problem, the negligible decrease in size after menopause is probably not going to do what you need it to do. You're still going to have significant problems. I operate on postmenopausal patients. I got a patient right now that's, this from uh, out of state. That, I mean, I think she might challenge you, Cola, like with her fibroids. Like, she's in her 60s, and I'm like, whoa. Like, she did a telehealth video. She sent me the ultrasound, and she like showed me where her stuff was at. I was like, Jesus. So I'm like, I'm even, and I say, like, it's everything can be done laparoscopically, or from a hysterectomy standpoint. I don't think I can get my instruments in there on her. So I literally have to see her to see if there's any room, because with you I had like this much room to put instruments in. Like,
And
I
you
don't
had
think
to
she
put
ever.
one on the side
Yeah,
low.
side, absolutely.
Yeah,
So
yeah.
like, I don't think she has that. Like, she can't even breathe because her fibroids are so big. So it's like, yeah, and she's postmenopausal. So with that being said, answer to the question of, does menopause cure it all? No, it doesn't. It really just depends on the person and where your fibroids are at menopause.
All right. Um, sorry, I keep closing it. All
It's all
right.
good.
How soon can a patient travel by air after a hysterectomy surgery?
Tough question. How was the hysterectomy performed? So, if the hysterectomy is performed laparoscopically, then yeah, they can do a couple of days and travel. If it was an open, tough surgery, like where somebody made a huge incision, then traveling in 3 or 4 days is not feasible, just for the increased risk of infection, bleeding, pain. So it really kind of depends on what's done, how it was done. I wouldn't say that all open surgeries, they can't travel within, a few days, but it's different. All open surgeries aren't created the same. Like I tell y'all, like, I have people with hysterectomies that were performed that had, incisions that go down from, their privates all the way above their navel, all the way close to their xiphoid. Somebody like that, they can't, they're gonna be out for a while. Whereas I've done myomectomies with like incisions literally like that, which is almost like minimally invasive. So it's like, I wouldn't care if they travel, but they both have open surgeries, but it's just different. It just really is a case by case basis.
All right. Do insurance companies cover elective hysterectomies?
You gotta have. Well, I don't. No, they don't. Not most of them. You know, if you have a designer type coverage, you may have some that may. But my question would be, why would you want a elective hysterectomy? You know, it's like hysterectomies or surgery in of itself should only be reserved for when you need it. So you can have an elective C-section for multitudes of different reasons. That's acceptable. But an elective hysterectomy, when there's absolutely no pathology, no abnormal bleeding, or no other issues, when you can do all types of things to stop bleeding, stop pregnancy, stop anything that could possibly be a physiologic issue, short of hysterectomy, insurance companies will not be too happy about paying for a lot of hysterectomies. And I promise you, like the managed care plans, like the public aid plans, the Blue Cross Blue Shield Family Health of the world, any public aid, they definitely they'll laugh at you if you try to send in for an elective hysterectomy. It's not gonna happen.
All right. Are you more susceptible to BV after a hysterectomy, even if you are not sexually active?
No, there's no reason for that. You're more susceptible to BV if you don't have proper vaginal hygiene. And when I say hygiene, it doesn't mean being clean or just cleanly. Like, some people don't understand that there are normal bacteria in the vagina that you just don't mess with, right? You don't stick water up there. You don't stick yoni pearls up there. You don't stick all of the herbs and spices and all types of, capitalistic, sprinkle stuff that I'm telling y'all, listen, I'm gonna sell out. You know, I'm getting I'm getting to the point. Why? Why do I keep doing things the right way, man? Like, just sell out. Like,
You gonna have a Shopify.
Y'all gonna see me, right? I'm gonna be like, yo, I'm gonna be on QVC. I'm gonna be like, yeah, y'all thought the Forex dude had it for real. It's like, he tripping. Nah, he for real. Like, he's selling straight miracle juice out here. Like, man, take this. It'll shrink everything.
By your retirement.
Yeah, just call it a day. Just be like, y'all call me what you want, and I'll just sit on the boat. So.
All right. Well, since you mentioned inserting, someone said in a previous video you mentioned not inserting anything in the vagina. Correct. Does this also include vinegar? Because I was always taught vinegar helps with tightening.
No, vinegar does not help with tightening. So no, don't stick vinegar in your vagina. What is vinegar, right? So vinegar has basic properties in it, so you're going to change your pH at the end of the day. Like, anything that's going to change your pH, you don't want to put it in your vagina. pH definitely matters 1,000%. You said I should have a client that sells $250K a month of feminine wash. See, that's what I'm talking about. That's what I'm talking about. Why am I fighting the good fight? I feel like, the preacher that's like, giving all of these free sermons and don't pass around a collection plate or something. You know what I mean? It's all these people that have absolutely no medical knowledge whatsoever, or they like don't even really have a lot of skill. They just like, all right, fine, I'm just gonna sell this stuff and get paid off of it. I need to put my name on something, Cole. I got to sign my name. Just call it a day. Just keep it moving.
You gotta keep it moving. I told you about your retirement.
Man. People be believing everything. They didn't want to argue with me. They didn't want to argue like, he don't know. He's like, you're a man. He don't know. All right, whatever.
Oh yeah, you're gonna hear that too.
Let me sell out. Then see what they feel.
All right. So a question in the chat bubble. Going back to your discussion on the open versus laparoscopic myomectomy, what are your thoughts? Huh?
I said, bring it. I love these questions. Go ahead.
What are your thoughts on using Accessa along with a lap myomectomy for complete treatment?
Good question. It's an excellent question, actually. So with that being said, I've heard a lot of quack stuff too, and I don't care what doctor who's out there that's like, oh my God, he's talking about, I don't care. Like, there are a lot of doctors that are upcharging to do stuff. right? That'll just add procedures to, and this is me bringing you behind the curtain. Like Jalen Rose say, come behind the curtain and I'll tell you, because I don't care. Like, I'm gonna tell y'all the truth. That's why I'm on here. But they will upcharge you with things, right, to do surgeries. I've seen like physicians are doing robotic myomectomies with Excessa, like upcharge, upcharge, upcharge. Like, it makes no sense, honestly. But this is when laparoscopic myomectomies make sense. There is an instance with Excessa. It's not intended for pedunculated fibroids, meaning fibroids that are like literally hanging off like little balls on the uterus. Like, they are like little stalks and they have these big fibroids off of it. Excessa is not made for that, because you'll kill the fibroid, but it's hanging on and it'll slough off, fall off in the belly, and it could be risk infection, can cause problems. So for those surgeries, Excessa is not indicated. So with those surgeries, absolutely laparoscopic myomectomy to get those pedunculated fibroids off and then treat the other fibroids with Excessa. It's absolutely indicated, and I do that all the time. I don't treat pedunculated fibroids with Excessa. I remove them and then treat the myometrial or even subserosal fibroids with Excessa. That's when it's indicated. But if you have a physician that's just going in there and say, oh, yeah, I'll take this one and I'll take that one, but then I'll treat that one or what have you, it makes no sense. It doesn't. Excessa is designed so you can keep it at a minimally invasive standpoint, and at a quicker standpoint without changing the architecture of the uterus and treating the fibroids, without having to dig into the uterus. If you're going to just do a laparoscopic myomectomy, just do a laparoscopic myomectomy. You don't need to do both of them, right? If you're going to go in there and you're going to start digging in the uterus, that woman is going to need a C-section in the future, do it. Just do the laparoscopic myomectomy. Excess is not needed then. But you could do a laparoscopic myomectomy for pedunculated fibroids. That's when it's indicated.
All right. If you're just joining, because I see the numbers changing again, please, if you want to join the live, feel free to send a request to DocP and you can join the live and ask your question and get a free consultation. Or if you want to submit a question, you can put it in the chat bubble. You don't, the one with the question mark in it, because then that way we can always screenshot whatever we don't get to.
Let's see. Yep. Because, yeah, nobody wanted to hop on here yet. So what are the chances of fibroids recurring after a myomectomy? That's a great question. And the answer to that, I don't like giving you the answer to it, but this is my opinion. So you can read, studies will show you anywhere from 20 to 50 to 60%. Like, you have multiple different studies that'll show different things, but this is what I say. It really depends on the surgeon. It really depends on the skill level. It really depends on the approach to it. Because I will tell you right now, anybody that I've performed an open myomectomy and I've sat there literally for an hour feeling their uterus, making sure I got every speck of fibroids, I cannot recall one, knock on wood, of those patients that I've had to bring back for fibroid surgery. I can't recall one, and that's doing over 100 of them at least. I could tell you multiple patients with laparoscopic myomectomies that I've had to go back in, or if I didn't have to go back in, they still have fibroids there that may not have been giving them issues, but they have recurring fibroids. So those numbers are skewed. It really depends on the approach. It depends on the person, because, again, even patients that have gotten open myomectomies, I can't even say that, because me and somebody else do myomectomies totally different. It's a ton of surgeons that are not going to sit up there an hour feeling to make sure your pea-sized fibroid is gone. They're going to get all of the ones they feel and see, and after that, close you up, call it a day. Whereas if they, I have literally been in cases where on the 45th minute out of the hour, I'm like, damn, there go another little one. Boom, taking it out. And that could be the difference between you coming back in 3 years with that being a 10 centimeter fibroid or not, just me taking that time to do that. So until they have a study on providers, until they have a study that looks at that, I can't really say the recurrence rate. The recurrence rates vary too much just because it's just, it's just too much variability in what you're looking at.
All right. Another question in the chat bubble. How likely is it that fibroids can be cancerous growths?
Very rare. So what you're talking about is uterine sarcoma, and that is like between 1 in 5 to 10,000. Have I seen it? Yes. Have I seen it very often? No. I can count on one hand, or maybe two hands, no, one hand, of patients that I've went in for routine fibroid surgery and it ended up being a cancer. That it doesn't happen very often. 99% of the times they're benign.
All right. Are there any tips for successful recovery after having a hand-assisted laparoscopic myomectomy?
Hand is a hand is so a hand assisted laparoscopic myomectomy means that they just had to create an incision to remove the fibroids. And with that being said, I'm about to deviate off your question. No, it's no different as far as the recovery is concerned. Like you're gonna do the same thing as far as recovery. You're gonna eat properly. You're going to drink a lot of water. You're going to exercise. Like overall health has a lot to do with recovery time, with your general health, like your female gynecologic health, every aspect of health, like how you take care of your body, how you eat, how you exercise, or whatever. So those things help recovery as well.
Okay. This is a sexual health question, and I promised this person I would ask it in the lab because I gave my personal opinion, and I said, no, I'm gonna get a medical opinion. Are you more susceptible to BV, or if you repeatedly get BV and are in a serious relationship, is the other person possibly cheating?
Is it possible? Yes. Is it like guaranteed? No, it's not. Because again, I could sit down and talk about a lot of different things, right? And these are things that people don't think about. One thing is like ultra hygiene. Just realize that whatever you introduce into the vagina, like it can change the pH and can cause you to have, is set up for infection. That means you get passionate and y'all just was out and you come back in and y'all had sex. Well, you just didn't hop out the shower, so there's bacteria that's being introduced into the vagina. Just that simple. Doesn't mean he's being with somebody. It just means that there's new bacteria into the vagina. Well, we always take showers before we take showers and stuff, whatever. He might have touched the doorknob. He might have touched something and touched it down there, right? That's bacteria that's introduced into it. It could be the slightest of different things. It's bacteria in the mouth, right? Like, so you have many different things that can introduce bacteria into the vagina other than another woman's vagina that's causing BV. So like don't sit and
Sorry.
believe the myth that I have recurrent BV doing something. It's not true. It's a multitude of different things. Maybe you were in the shower and you was washing a little too vigorously and put water a little bit higher than it was supposed to go. Guess what? You increase your risk for vaginitis. Or you've used some feminine sprays and stuff down there that can also change your pH, or yoni pearls, or wore too tight of clothing or what have you, or maybe just had a long day and didn't change your underwear or whatever maybe when you should have, or didn't take a shower and wash something. Yeah, it's so many different things that come into it. So don't automatically assume that recurrent BV is just because somebody cheating or doing something.
Okay. I'm sorry, people was going off in the comments.
I bet.
They
I
said you riding for the dude.
I ain't right. I'm telling you the truth. Listen, I'm telling y'all the truth.
Well, when the person asked me, the way I answered the question was, I said, DocP always says two things can be true at the same time. I said, so I just know from my personal experience, if I found out somebody was unfaithful, I was uncomfortable. In relationships where I've had comfortable vaginal repeatedly, I didn't have any suspect. So I just said two things could be true at the same time. So
Look,
let's ask the expert.
yeah, man. I ain't just riding for guys. I'm telling you the truth. Somebody wanted to hop on here. Look like, wait up. All right, somebody want to hop on here. Let's see. Said I'm riding for the dudes on my friend.
Hello. Hello.
Hello, what's happening?
Okay, let me turn y'all up. There we go. I can hear y'all now. How you doing?
What's happening?
As well.
What's your name?
I'm Cortia.
Cortia, pleasure to meet you.
Nice to meet you. Nice to meet you.
What's your question?
So, hi.
Hi.
So with fibroids, I had a myomectomy 4 or 5 years ago, and so the fibroids, they grew back.
Mm-hmm.
And you said something earlier about fibroids not growing back after you did the surgery.
I'm talking about for me.
Dang.
So I can't speak on everybody. Like I said, like I've seen some of everything. I've had one patient that has literally came to me, flew from another state in, that they opened her, literally, they opened her belly, saw her fibroids, took pictures of them, and closed her back up. Kid you not. She came up here, I did her fibroid surgery, everything went successful, but she underwent a huge surgery for nothing, right? And I've seen people that have literally went in, taken out the fibroids that they really wanted to take out and they were comfortable with, and then they would say that the fibroids, are too close to a blood supply or whatever, and just leave certain fibroids behind, right? So I can't compare those to myself or to, what I think should be, something that I would advise you, because I really don't know what your surgeon did. But I will tell you, like, again, like when I am doing a surgery, and I'm not just promoting myself, a lot of the stuff I'm saying, so that if I actually do have OBs that are like listening in, that they like taking notes too, anywhere I go, I try to like drop gems, and I try to talk to people, hopefully kind of change their perceptions.
Yeah.
To go the extra mile. But I literally will be in there for about 45 minutes to an hour doing this to a uterus, pulling the uterus out and just doing this up and down, up and down, up and down, back and forth, back and forth. Have my assistant like make sure like you rub it too, just to see if there's anything that I'm missing,
Right.
before I close it up and put it back in. And when you do that, the incidence of fibroids coming back are extremely low in my experience.
Okay. I'm gonna have to make an appointment with you.
So you saw.
Yeah, I'm sick of this. Sick
I
of
bet. I bet. But don't always think so. Another thing too, and I don't know your complete story, but a lot of women also feel that like if the fibroids come back, you have to necessarily do something about it. You don't, because remember, 80% of women have fibroids, right? And just because they're there doesn't necessarily mean you need to operate. And just because they're there, they're not necessarily causing you to have abnormal bleeding or some of your other issues. So you need somebody that's very knowledgeable about women's health, reproductive health, to understand whether or not you need surgery or not. Because if you have a 4 centimeter, 5 centimeter fibroid and it's not causing you to have any issue, leave it alone.
But my stomach, I want it flat.
Talk about that too. So we gotta look at what that. And so if I will be honest and be like, listen, your belly is protruding from fibroids, or your belly is protruding because you like to eat carbs. It could be two totally different things. Two things at the same time. Like I say, right? So if your fibroids are actually causing a problem, then yeah, I'll be like, okay, well, we need to address it. But a 4, 5, 6 centimeter fibroid is not going to cause you to have a protruding belly. You need to have like 10 and better.
Okay.
No, it's 9 and better to truly cause protuberance of the abdomen.
Okay.
Cool.
Well, I'll be making my appointment soon as soon as like insurance changes, and yeah.
Got you. All right. Pleasure. Talk to you soon.
Thank you.
Thank you.
I'll be messing with this.
You got to do it at the top.
Yeah.
See, I learned something last week or last month.
You did. They did ride. It was like, she did. He riding for like, boy, y'all tough, man.
That's why I was laughing. I couldn't help it because they was going in.
Man, see, too bad it ain't no dudes.
See, this is a patient perspective.
I know.
Other patients can say that we've seen two things be true at the same time.
That's what I said. I said it's true. I said two things at the same
it's
time.
Just the common denominator was always an unfaithful dude.
Don't vilify them all. Damn.
All right, another sexual health question since we was on the topic. It says, thank you both for doing the lives. I really appreciate the monthly content. We have talked about ovaries stopping hormone production in women at a certain age point in life regularly in the lives. What is the age range of a male not being able to have an erection without medicine?
Shit. Yeah, it depends on the male. Again, it's like men are not created equal. You got 70-year-olds that eat right, that exercise, that drink water, that don't smoke, that don't do anything that's like damage to their health. Their bodies function like 40-year-old men. Whereas you have somebody that lived a hard life, like he gonna need some help. You know what I mean? So it's like there are men in their 70s and 80s that can have erections and have sex without any medication. Just really depends on how they take care of themselves. A lot of ED has to do with peripheral vascular disease, which has a lot to do with diet, cholesterol, how diabetes. Like it has a lot to do with a lot of that stuff. So if you have a man that is completely healthy, that works out, that is eating right, don't think that sugar daddy gonna be an easy win. He gonna make you
he gonna want sugar.
You gonna earn that shit. I don't think you gonna get flew out and think that shit gonna be okay. He gonna be like, well, we ain't going to sleep just yet, mama. Come on in here, come earn it.
Oh, hilarious. All right. This one is for me. Cola, why didn't your previous OBGYN want to tie your tubes? Was it related to complications with fibroids? No. So I didn't have fibroids when I was bearing children. My doctor actually didn't want to tie my tubes for two reasons. Number one, she felt I was too young, and she really wanted me to consider doing surrogacy because she said that I delivered really well, whatever that means. But that was one reason. So she really, really kept approaching me about being a surrogate. She had patients that wanted children, and she said I was a good candidate to bear them. I was in a different mindset back then. Maybe I would have given one.
Were they trying to bring you a bag for this?
Oh, it was definitely a whole.
Oh, okay. I'm about to say, like, man,
it wasn't just charity work.
Oh, okay.
No.
Damn.
No, she said that she had been doing her residency since 79 or something. And she said the way I delivered, she was like, you a perfect candidate for a surrogate or whatever. So like I said, whatever that means. So that was one reason. Another reason was she didn't like who I was married to at the time I was having kids. And she was one of those doctors that'll give you her personal opinion. And she was like, I want you to meet somebody else and be able to give them children. So you don't need to stop because you need to find somebody that somebody else to give a baby to. So those two reasons. But I didn't have fibroids when I was having kids. Much they came way later. All right. What are your thoughts on? Oh, I'm sorry. You got
question.
Because the ones on the screen be too little for me. So
got you. Go ahead.